pressure ulcer is a localized area on the skin with decreased blood flow that results in death of the skin or underlying tissue. Pressure ulcer formation is a risk for all patients, but occurs more often in the elderly and the physically disabled population. Pressure ulcers are painful, debilitating, and may be lethal. According to the Centers for Disease Control and Prevention website in 2011, over 2.5 million people suffer with pressure ulcers each year, and roughly 60,000 people die from pressure ulcers complications. There are several interventions one can take to prevent or reduce the development of pressure ulcers, including proper positioning, proper nutrition, proper hygiene, and implementing a prevention plan. Here I have what a pressure ulcers look like. The top two are different pressure ulcers. Proper positioning allows adequate blood flow to the body, reduces pressure of the body's tissues, and decreases friction and damage to the skin. An article out of the Critical Care Medicine, DeLotte, 2007, conducted a study over a 2-year period involving 399 patients in the intensive care unit of a university hospital. The results of this study showed pressure ulcer incidence dropped from 43% in those placed on conventional mattresses down to 28% in those placed on specialized pressure relieving mattresses. Here I have an airflow pressure mattress for someone to lay on that there's airflow to try and help prevent from just laying on an old mattress with springs. And here's a Roho air-filled cushion where it has less air in spots, so all their pressure isn't in one spot to try to help prevent it. Proper positioning allows adequate blood flow to the body. Positioning to prevent pressure ulcers can involve several different regimens. These regimens include, but are not limited to, pressure relieving mattresses and cushions, and positioning schedules and techniques. Here is to help position them, different things, different cushions to keep them in the position you put them. And here I have a picture of pressure points, the heels, the toes, the buttocks, the base of the spine, their shoulder, the back of the head, just where they need to be, moved around to try to help prevent like their heels and hands and different areas from getting these sores. Proper nutrition helps keep the body healthy, aids in tissue repair, and decreases the chance of secondary infections. Adequate hydration is important for skin's elasticity and integrity. Ferguson, 2009, reports that a recent study showed malnutrition to be a key factor in pressure ulcer development, more so than improper positioning. A study in 2007 revealed that patients adequately hydrated had a decrease in pressure ulcers by 4% compared to those with the problems of dehydration. Ferguson, August 2000. Proper hygiene helps protect the skin, which serves as a barrier to bodily tissues. Regimens such as moisturizing dry skin areas, applying barrier creams, and cleansing the skin all aid in protecting the skin and minimize skin breakdowns. Sebald, Norton, Wu, 2009. Implementation of a prevention plan is a standard guideline for a facility to follow. It serves as a strategic blueprint for healthcare professionals to follow regarding prevention and care of patients with pressure ulcers or at risk for developing pressure ulcers. In the guide advances in skin and wound care, Zakelis, 2001, reports results of a study conducted in a 77-bed facility based on the outcomes before and after implementation of a new prevention protocol. Prior to 1994, the facility did not use a prevention protocol for pressure ulcers. In 1994, a new plan was implemented consisting of a use of the Braden scale, repositioning schedules, and the use of relieving devices. Results of the study showed pressure ulcers' occurrence and healing time had decreased, and the time it took to develop a pressure ulcer had increased. In conclusion, evidence shows that there are multiple ways to prevent or reduce pressure ulcers occurrences. All persons who deal with a patient are at risk for pressure ulcers should take the time to provide proper positioning, proper nutrition, proper hygiene, implementing a prevention plan. It is only when all of these above precautions are followed, the pressure ulcer formation can be reduced.